and keep writing your questions into the chat box, and we'll try and catch them as we go. Thank you so much. I'll hand it over to Mariana.
Good morning. As Jan said, we can't believe it. It's October and almost November, and all these things began in March. And as some of you know, I am originally from Chile, and we begin school in March. We are in the other hemisphere, so we have school March to December. So I'm hoping that we will end this before December, or we're going to be repeating the class with all the teachers. So today, we prepare something to reinforce some concepts, and it's because we have been receiving information and from schools on cases, but also from people that we're interviewing, that they are receiving contradictory information. So let me first, how do we do it? Oh, that's it. Whoops. Okay, so the first thing that I need to repeat, and this is like the Groundhog Day, quarantine please means confirmed exposure, somebody that was exposed to somebody that was positive, and that is period of time is 14 days. And the quarantine of a person that has a confirmed exposure doesn't mean that the friend that didn't have the exposure will need to quarantine too. So only the confirmed exposure, only the person that was in contact with that positive case. Now the isolation, we mainly refer that when the person is sick, and this is only for 10 days. And if you ask why the difference on days, it's very simple. The quarantine lasts an incubation period of the disease. In 14 days, we're gonna know if you have it or if you don't. That's the average time. The isolation is the time that it has been established that the virus cannot reproduce if it is still present in the nose or the person is shedding. CDC from the beginning was testing people daily and doing viral cultures daily, and they said they realized that maximum day 9, the virus is still able to grow if the person has symptoms, but day 10, they do not, even if they still have symptoms or even if it's still present on the PCR. And that's how they get into the 10 days since the beginning of symptoms. And when we don't have symptoms, what we take as a reference is the beginning of the day that they test. So I don't know how you go to the next one. Anyways, yeah. So anyways, if you have any questions, this is a very nice flyer that the students from the U of A are helping us developing things from Pinal County. It has the county logo, it has the U of A logo, and you can find it in that website. It's our website, and we're gonna check on resources later too. So, give me the next one. Yeah. So how do you end the quarantine? This is a very typical question, and it's a concept that is not really well understood. The quarantine will end when a confirmed exposure doesn't have symptoms during 14 days. So if nothing happened, that means, well, your confirmed exposure, you were with somebody positive, but it was not, you didn't get the disease, 14 days, you are okay. Next. So do not short quarantine because somebody have a negative test result after 72 hours. We really have been fighting this with the schools. We don't know where that came from, but it's very popular. And no, the person that has a confirmed exposure needs to wait for the 14 days. So now, if the person is in quarantine and they develop symptoms, they should go to test. We really need them to test because the most possible thing is that they have a COVID. But also we will need to see if it is too bad, if they need to go to a doctor, but we need to confirm the case, because a confirmed exposure will give them with symptoms, will definitely make them a probable case, but we need to be a confirmed case. That's why we need them to go to test. Next.
The question that I received already is when in quarantine, because we know that it might take a few days.
When
Should they
according to
test?
what?
Should they test?
Oh, yeah. I have it later.
Okay.
So if the test is positive, when the person goes to test, it's a confirmed case, and then it goes to isolation. Now, when somebody is in quarantine and they do not have symptoms, actually, it's not necessary to test. That's the first thing. Now, if somebody prefers to test during quarantine to avoid having somebody asymptomatic going around, it needs to be at the end of the quarantine, between 10 day and 12. So you receive in 2 days, you receive the test results, and you are okay going back to school. But it's not necessary. You don't need a test to release from quarantine. That's the most important thing. Okay, next one. What happened with isolation? So this person that was in quarantine and at day 10, actually, we'll put both examples. At day 10 begins symptoms, or at day 10 decides to go on testing and test positive. This person now, it could be asymptomatic. If they have symptoms, of course, it's symptomatic and needs to be at home for 10 days after the symptom onset. Oh. So the isolation will count since the day of symptoms onset, and last 24 hours needs to be without any symptom, especially any fever, without taking any medication against the fever. If all that is okay, 10 days, last 24 hours without fever, without medication, they are released from isolation. Next. So if they decided to test at the 10 to see if they were asymptomatic and oops, they were positive, then the count of the first day of isolation, it counts since the day of the sample. It doesn't matter that they sample on quarantine day 14. If they have a positive test, they need to isolate for 10 more days. So that's why it's very, take it easy when you want to test too many people. Next. The last thing, and this is super important, do not ask for a negative result to release from isolation or before going back to school. So again, at the beginning, we didn't know too well, so we were supposed to wait for 72 hours without symptoms. Then, after all what we have learned during this time since March, we know that it's the last 24 hours without symptoms. We also know that the virus grows in people that are shedding until day 9, so 10 days is okay. We also know that there are people that can be testing positive for months. We have seen even 2 months, 8 weeks, 10 weeks, and they're still getting a positive result of PCR. That virus is not alive, is not able to be infected, and therefore the CDC discard that idea, because if not, there are some people that will be in quarantine forever. And this happened at the beginning of this pandemic, that was people on quarantine in isolation, for 3 months. So let's go in the next one. So how do we report a case to PNAL? And this is the other thing that has been a complication all the time. First of all, please fill a case report. Then call or email, and then you will get support from public health, from Pinal County Public Health. We cannot give you support if we don't know that you have a case, and if we don't know who or when or where to contact. Now, a lot of people is like, whoa, but do we report everybody? No, you don't report everybody. So far, what it has been working is that if a kid or a parent or a staff member said, Well, I tested positive. Those cases, please send us a case report. If somebody says, I feel so bad, I need to be tested, those cases, send us a case report. If also there is somebody that said that a kid that said the parents picked them up from school because the mother was positive and the father comes and pick them up, that's a confirmed exposure. Please report it. You don't need to send them to test. You need to send them to quarantine, and that will come. Those explanations will come on the support from public health. But if you don't do the case report and call or email, we don't know. So next. The case report is in this website. When you open the website, you're gonna see the school and childcare, and then if you keep scrolling down, you're gonna see the benchmarks definition. You keep scrolling down, you see the definition, and then you're gonna hit the school forms for school reporting COVID-19, the immunization flu shots for individuals and family, and all these webinars that has been archived there. So if you go for the case report, this is the section on there. There are two things that we will change today, and one is that needs to be submitted by fax. We cannot accept anything by email anymore. And also at the end it says download the documents, because you can download the case report, but you also there we have the Excel contact tracing that looks like this, and this one when you download it, hit again, you need to enable editing to be able to write something and save. We really need this in Excel, not in PDF. I keep telling everybody, please send it in Excel. And I understand that to not mess up the data, you send it in PDF, but we need it in Excel because we do everything automatically with ADHS to upload to and distribute the case contacts to be of course contacted by phone and follow up. So we really need you to set it in Excel. Okay, so the next thing. So you have the forms, you know where to find it. Actually, the form is fillable. When you download it, you can fill it, save it. That can be PDF. And then next step, call or email. First option actually is call. If it's 825, you can call me, you can call Joel. Joel is our general infectious disease epidemiologist, and we together are looking at everything, because if one is here, the other is not, somebody knows what to do. So 825, call. Even if it is not 825, everybody has my cell phone, and you had been calling or texting, please call. Sunday, it doesn't matter. And if you don't find me for any reason, you can leave a message or call the duty officer. And that's the number. So far, 50% of the time I will answer anyways because I'm going to be on duty. The other 50% is going to be Corey, and she knows how to tell you what to do. And also, even if you call, please email us. It's very difficult to be somewhere and spelling emails and things. So please, you have our emails, please email us and copy these three, me, Joel, and Ides. So we all receive the information, and we do not need the case reports there. The next thing is the support from public health. So if you can't fax, and we have been discussing with our IT, and IT says it's on the other side, not in our side, but we still have many schools that says that the fax don't go through. If you can't fax, we can't receive anything by common email because it's a HIPAA violation and it's complicated for us. So when you email us, just tell us, hey, I'm this person from this school and we have problems with the fax. Please send a secure link by email and we will send to you. The county has a shared Dropbox where you can upload everything that is secure and it will not put us in trouble. Then we will begin talking. if it is necessary to do contact tracing or not. Not everybody needs to do contact tracing, and not every case will need to do the same amount of contact tracing. We will discuss with you what we need, what are going to be the next step, and how we continue on this if we get to an outbreak. If you need flyers, educational materials, whatever you saw that one, that quarantine, any other thing, let us know. We can send the PDF by the email, by normal email. And then if we declare the outbreak, and this is very clear, we declare the outbreak, not the school. The definition of the outbreak comes not only in the number of cases, if they are related by family or not. We need to actually establish transmission on school grounds, and that comes after the epidemiological investigation. Even if you can have 20 cases in the school ground and you still don't have transmission in school ground, you do not have an outbreak. That's why we are the ones that are going to use that word, and we are the ones that are going to tell ADHS, yes, we have, this school has an outbreak. At this moment, we have 6 open outbreaks, but we have reports from at least 20 schools, and we're following up very close. And every time that you send the reports, we prioritize those investigations, and we ask the people where they were. Is it possible that you got it in other place or anything? And then comes the important decision. And in this important decision, the question is, are you going to close my school? Is always there. And yes, we did it. We did it because it was too much to be able to control the outbreak if we didn't do it. But also sometimes when we said you should quarantine all of these people, you need to follow it because it's actually part of the law, but you will have administrative problems. Because if we quarantine half of your students and half of your teachers because of exposure, then you will have the support from the public health, Pinal County Public Health, to bring that to your Board of Education and said, well, we have a problem, we need to quarantine, and we can continue doing this in person. So those important decisions were always, we will have some call between whoever you need to be there, and we will kind of share what is happening, what is our position, what we recommend, what you need, and come to common ground. So please be sure that if we said we really need to close, it's not that today, this morning, I woke up and I decided to close at school. It has been a decision that we have been thinking and working and discussing for at least 5 days or more. Okay. I don't know, we can stop here because we're going to go to the numbers. If any questions about the report.
Sure. Wanda asks, if a person is sick but not exactly COVID symptoms, do they need to quarantine for 14 days or just until they are feeling better? The subject is for a teacher that's not feeling well, but no confirmed exposure to any person with COVID-19.
You can have no confirmed exposure, you can still have COVID-19. Mm-hmm. So it's a very difficult question. It will depend more on how the things is evolving. And you need to follow first the school's guidelines of not having anybody sick at home, at the school. And then that person, like a teacher, will need to better go to a doctor and clarify it if it is not. Because you know what? We always don't want it to be, but sometimes it is. So it's better. We have been tested here. We test ourselves every time that we have any questions about it could be, we better do it, and we go to Paradigm. That easy. We don't even do it ourselves. We go to any place. We have people testing in Boston Butte. So to be sure that we're doing the best test and not put at risk our fellows, employees here, colleagues here, because we need to be okay here to work with you. So that will depend.
Yes, I mean, you could get it from the grocery store, you would
Yeah.
never know.
Yeah, also because your exposure, maybe you don't know your exposure. Maybe you went to the supermarket, to the grocery store. Some people are going to the gym, and it's still a risk. You take your own risk, but we need to be sure.
Okay, Lauren's asking, when we have a confirmed case, wait, let me make sure I'm reading this right. When we have a confirmed case, do we initially fill out the contact tracing form emailed to us a couple weeks ago, or the COVID case report to public health?
You need to first report the case. We will discuss the case after receiving the report or after you calling us, hey, I just faxed you or I just sent it. And we will review it and we will tell you what we need from there. We will make some other questions to you. Well, this is the first report that you do. Do you have any other people that you haven't report? And especially we need to confirm that this case that told you that it's positive shows up positive in our database. And believe me, there are some people that said that they're positive and they never showed up in our database. So we need to, the first rule of working an outbreak is confirmed the disease. So we cannot do anything not too much until we have the test result in the system that is called MedSys.
Okay, before I get to Lori's question, I wanted to mention, it sounds like the folks on this call are hearing some background noise, and I apologize. We're actually calling from the Incident Command Center today. So I'm going into the room, they're actually taking calls from doctors and things like that. And so I apologize for that. Let's see. The question I had was,
Thank you so much.
If a contact person tests negative 2 days after exposure to the COVID positive person's positive test, do they still need to quarantine, a 14-day quarantine? Let me say that again. So we have a person with COVID that tests positive. 2 days later, a contact goes in and tests negative. Do they still need the 14-day quarantine?
Yes. Again, the person that is a contact needs to do the 14 days, especially because we review it 2 or 3, I think 2 meetings ago. If somebody says today that test positive, we have between 2 and 14 incubation days. So even if that day was the last day of exposure and somebody just ran out and get a test and it's negative, they're going to have the false sense that they are negative. And you still need to go through the incubation period, the whole incubation period with the disease to know if you're going to have it. So especially because if that was your only exposure, then 2 days later, of course, you're going to be negative sometimes. We haven't really seen too many people that develops the disease day 2. What we see is that people develop the disease between day 5 and day 9, and the average is a week. So you go there, and that's also the reason why you don't let anybody come back with a negative test that was 72 hours after the exposure, because you still can develop symptoms, and we have had it in some outbreaks. People developing symptoms day 12, day 13. So we keep saying, do not run out to test. Go to test if you have symptoms, or wait until the end, almost the end of the quarantine.
Okay, Lisa's saying that they're having rapid test results being submitted to them as proof. So how reliable are these tests? Should the individuals be allowed back on campus with a negative rapid test and symptom-free for 24 hours?
Rapid tests, we have two kinds of rapid tests. There are antigen tests and there are PCR tests. The antigen test, if you're positive, those are only probable cases, and they need to have certain characteristics to be considered valid. So they need to have been done between, some of them, there are 7 in the market. Some of them only allowed to test between day 1 and day 3. The majority is between day 1 and day 5 with symptoms. So you always need to have symptoms for an antigen test. And even with that, the sensitivity of the test do not pass 88%. They go between 84 and 85. So at least almost 2 in 10, you're going to miss it that they're positive, and you're going to let somebody come back in if you're using 2 release of quarantine. So that's another reason why no. If the person was in isolation, you don't need any negative test to come back, so don't use it either. If they are PCR, the PCR should be confirmed by nasopharyngeal swab. The antigen also should be confirmed by nasopharyngeal swab. That's why they are reported as presumptive negative or presumptive positive. So the summary is maybe if a rapid PCR or a rapid antigen is positive, you could be sure that the person is sick. If the rapid PCR or antigen is negative, you cannot. And that's why you cannot let them come back to the school if they are in quarantine. If they are in isolation, again, you don't need a negative test to let them come back after 10 days.
Okay. I have a question from a teacher here, and it seems like there's a couple of issues going on. So one is a student may return to school sooner than the 14-day quarantine if the parent provides a note to our nurse showing that the student took a COVID test and the result came back negative. And the other one is that it seems as though this teacher may not have an understanding of the difference between the 10 days within isolation and the 14 days within quarantine.
Okay, so again, first, we have been saying when somebody doesn't want to test and doesn't want to go to the doctor and has symptoms, we will consider them positive and we will not let them come back after they isolate themselves. If somebody really goes to the length to go to the doctor and test negative, and the doctor said, well, this looks like it's a sinus infection, and we give them antibiotics, that's kind of the only time we cannot go against the doctors. But our recommendation will still to wait 14 days, even though the test could be negative, and it's because you can have been testing too soon. And maybe after 5 days with antibiotics, the case don't improve, and you retest and they're positive. So we stand our ground in saying, do not come back before 14 days if you really think that it's COVID. Some kids with asthma or other things, the doctor will need to give you a better indication, and that will be the only time that we will say, well, if the doctor said that, but we still recommend the rest. And what we have been seeing is people going to the doctor, and the doctor said, you should test anyways, and you should do whatever public health says anyways. So hopefully that's what you are seeing.
Okay, and just to clarify, 10 days is isolation, and that's for somebody that tested positive. But
Yes.
14 days is quarantine, and that's for somebody that has been in close contact.
Close contact and not.
Exposure,
Or
an
had
exposure.
Right. Okay.
So I think that I said this at the beginning of the story. The quarantine word comes from the 40 days that the ships were supposed to be out before disembarking anybody, to be sure that they didn't bring measles, smallpox, or tuberculosis into the place. So you're waiting to see if you're bringing something. You're waiting to see if you have, if you will develop the disease. That's the quarantine. And now we know better, so the quarantine is 1 incubation period. In measles is 21 days. In varicella is 7. In COVID is 14. So that number will change and it's 14. Now, the isolation, if that ship detected somebody with smallpox, nobody could go down until everybody went through the disease. And that's the isolation period. And that is 10 days. and it is 10 days because after day 10, the test that CDC had been doing demonstrated that after day 9, the virus will not grow in vitro, so it's not contagious. So they use one more day.
Okay, I have one more question before I let you get to the situation report, which I know is the important part everybody's waiting for, so. If a student has no confirmed exposure and has a cold or allergy symptoms, are they okay to return to school when their symptoms have resolved?
We're going again into super specific things, and in that case, that's when the note from the doctor will kind of go over. But they need to discuss that with the doctor. We cannot take the responsibility on telling you what medically happened because we are not medical health providers. To know that this kid actually doesn't have an infection and it's actually an asthma attack, you will need to go and check if they're wheezing, this and that, and maybe takes an x-ray. There is a lot of things that need to happen. Take the saturation. The nurses know. Just please rely on your nurses. That's why you have nurses at school.
Okay, do you want to give, I have a couple more questions rolling in, but in the meantime, do you want to do the situation report and we can circle back?
Okay, so let's do the situation report. We will talk about what we have seen in the county until week 43. And week 43 is between 10:18 and 10:24. That was last Saturday. So as you have seen this many times, and I haven't explained everything. So just focus, please, in week 38 and up, how this has been going up, the cases that are reported and the cases that are confirmed. Actually, we have 2 peaks in the case that are reported. So we know that at some point, people were testing more, or they were, for example, doing antigen tests. That's going to be reflected in the report. But the confirmed are really going up. Not as bad as the beginning, but they're really going up. So next one. So in this one, if you click one, I want you to see that line, and that's the acceleration of the pandemic after Memorial Day. And this was an exponential, because in the news, they had begun talking again about the exponential increase of number of cases. We have the first week, we have 120. The next week, we have 250. Then we have 500. Then we have 1,000. That angle or that inclination means a really rapid increase of cases. Now you see that lately, at least in the last 5 to 6 weeks, we keep going up too. Maybe not. It's not that that fast growing, because what we're seeing is every week we have the same number of cases plus 50, plus 60. But this could curve up like the first place, and that's when we're in trouble again. So far, we're holding up, but we're in trouble again. And this, we replace a couple of things in the website for this graph, because this is weekly. We need to have the previous week done over to give the data. It's going to be replaced every Wednesday, update every Wednesday. But you can find it in that website. You need to scroll down. Yeah. And the death has been a little bit going down, but so far we're in 217 deaths confirmed. Yesterday, I think we confirmed 2 more and have 1 pending to confirm. This death for everybody to be to trust that we don't put everybody that died under the COVID diagnosis. We go through every case and analyze and really confirm that these are COVID deaths and nothing else. We have eliminated death from here. If you go to the website from ADHS website, sometimes you're going to see -1 or -2. This happened with cases and with death. With cases, it's mainly because it's determined that they were in other place or live in other place, so they move jurisdiction. in death is because we check and that death is not really a COVID death. So to not forget, this is the flu season. And last year in week 43, we have only one case and we were up to 7 cases total. Now at the beginning, you can see a line that is in 0, but a little bit darker than the rest. That's the 2020, 2021. So we're up to 0 case and 0 case cumulative. And we still cannot tell you if it is because there's actually no flu circulating or it's because nobody's testing for flu. So that we will need some time to be able to answer that question. Next one. The other thing that we always do surveillance, disease surveillance during this time is the RSV. This is the respiratory syncytial virus. And 2019-20, we have 0 cases in week 43. Oh, that's a mistake. We only have, that's the total for the whole season. And in 2021, so far, we have 0 cases in week 14, and we have seen 1. And you can see it there over week 42. There is a small square that says 1. So that's the situation. This is something that we, ADHS and every county continue to check because these two have the possibility to do co-infection with COVID, and that is not a good panorama, especially in kids. Okay, so we go to benchmarks. You want to go through questions?
The question I have is more of a clinical nature. It's if a student is undergoing precautionary testing for COVID and does not have any symptoms, should we wait for the test results or allow the student to come back to school because the student doesn't have any symptoms? Or should we play it safe and wait for the test results?
I'm guessing precautionary test means they're going to have a surgery or something. There's no need to be testing just in case every week. That's the first thing. No the teacher, not the students, no the coach, no nobody. That is really too extreme for us. We are asking people to only go for that if the doctor requires, if you have a dental appointment, if you're going to have elective surgery, things like that. But at the moment that somebody needs to be tested, we ask for staying at home waiting for the test results. And in the case that this person will be having surgery, the idea of testing them is to know that they're not sick. Therefore, they should be at home waiting for the surgery instead of being exposed themselves outside. So, and I apologize, I didn't change the benchmarks review because it's for the week. The weeks that we're gonna see are the 2 previous weeks. So 40 and 41.
Yeah, Charity already caught that. There you go, good catch.
Yeah. It's because I have the whole presentation done for today, but we decided to review some concepts instead of having a case study that I wanted to show. So that's my fault. So we have some questions, and I'm going to refer to a question that we received today about the yellow mark and the 7% that has been super confusing for everybody because ADHS didn't have it at the beginning. Since the beginning, ADHS established this school benchmark information. This comes from ADHS schools toolkit, and you can see that from the beginning, ADHS said minimum, moderate, and the other one is increased.
Substantial.
Substantial. So they always have this. And the minimum is under 5% of positivity rate, under 10 cases per 100,000, and with the COVID-like illness, under 5% of activity. So when that happens, it's not really too much what is happening in the community. Moderate, since the beginning, was between the cases between 10 and 100 cases per 100,000. the percentage of positivity was between 5 and 10, and the COVID-like illness was between 5 and 10. And then the substantial is when we really are receiving cases, a lot of cases report, over 100 cases per 100,000, more than 10% of positivity rate, and more than 10% is COVID-like illness. Now, this is why we were fighting with ADHS, and all the counties were fighting with ADHS, because they put this and they didn't put the yellow. And they came on the benchmarks with that 7% in between that really make it difficult for everybody to understand. So from the beginning, because it says in one of the questions that we received says this is a confusing change between the yellow and the red. It's not a change. It's just demonstrated or picture different. So please remember, moderate the green, the yellow, and the red. And in the top, it says which model is recommended and why. So in the next one, if you go to ADHS website, you're going to see this. And click one more, please. You have that safely returning to in-person instruction. That is a link that will take you to the updated presentation of those, and that will have all the explanation that I just have, but much better than me. And one of the important things, other thing is that when you go to the ADHS first at the website, you're seeing all counties. You need to click in the map on the side to do Pinal. And also you see, let's see the next one. You see the hybrid, the recommendation, the delivery model, that is for the whole state. Now, because the schools wanted to know their special situation, we go ahead and get the zip code data, and we are giving the zip code data, and that you're going to see after. And we, from the beginning, we have been giving green, yellow, and red. And that's also why we were not posting anymore in the website, because it was confused for the schools in understanding why we have yellow and ADHS didn't have yellow. So next, in the first thing, and that's where you click on Pinal. So for Pinal County only, the recommendation already is hybrid. And you can see how much we have been going up. It's kind of the same situation that you saw in the curve. You see September 20th was a little bit lower. So we have been increasing on number of cases from September 6th. And we already, if that 7% would be there, we will be already up to. So we are in yellow. They finally show up in yellow. Next. And in this next, we are over 5%. So between 5 and 10 is yellow. And we are in yellow already. We have 2 benchmarks that we are over in yellow. The last one is still green, but that's because that will measure how many people go to the emergency room. And now not too many people are going to the emergency room because you can go and test anywhere. So we don't really give too much value to that one, but more to the other ones that are hard measures. So this is an extract of our website. We have the same thing in our website, and at the top we have that thing that it says that had all these explanations. So again, we have not changed anything. The 7% of positive rate was something that ADHS didn't even have in their website explained, and that's why we were not comparing things and leave the official website from ADHS. But now they are doing it as we're doing. So the next one. When you receive our information, this is what you're going to receive. The last day that it was done and the colors. So we have already 2 districts in red, Eloy and Toltec Elementary School District. And the rest are, almost all the rest are yellow, and we have a couple of greens. According to ADHS, after 2 weeks of the same color, you should be going into the recommended mode, instruction model. So Eloy and Toltec should be like looking around and see if this Thursday is red again. You should begin considering going the other side, especially for the tendency that I already showed you. That's why I am showing you 2 weeks in advance of what this is saying. That's what we're showing you there, because we want you to be prepared, and we are going up. So this is going to be those colors or worse. They're not coming back. So next. One thing that we always have, the question is for this school district that has correctional facilities. And Eloy is just the one that is red, and they have a lot of correctional facilities. We have made a lot of analysis this, and we keep monitoring how many cases we have in correctionals. So still, only 16% of the total cases are in correctional facilities, and we monitor specifically the 2 zip codes that are more affected. One is Eloy and the other one is Florence. And when we give the color, we kind of average and subtract the correctional numbers per zip code, so we know what to give you counting only community cases. So please trust us that we are doing that. And the next one. And we still monitor every day what happened in Pinal County, and we have this graph that done every day by our data analyst. The blue ones are the amount of cases that are in correctionals, and the red, the amount of cases in the community. And you can see that even though there are cases in between week 40 and up, it's not that many compared with the community. Now, between week 35 and 37, yes, it was more cases in correctionals than in the community. But we have all these graphs to know. So again, please try to retain the concept. Ask us, report. We cannot help if you don't report. And call us with questions. And that's it. And now here are our legs from Thanksgiving.
Okay, I do have one question about the data that you just presented. It says, I do understand the measurements. However, the benchmarks prior to this week were turning red after the 7%, not the 10%.
Yeah, and that's, can you go to the before? Yeah.
So
Yes, and that was what we said, that is here.
Okay, so the question is, so when Pinal County sends us the report, if it's red, is it over 10% or over 7%?
Yeah. So because that was our fight with ADHS, that they were turning over 7 red, we always follow this that we have in there. So if we mark you red, you have at least 1 red, and that's in the small place. Maybe we can see here. If you see here in the red, it says 1 or more benchmarks in the red category. Here, it says all 3 benchmark in the yellow or green categories. And here, all 3 need to be green. So that's how we are doing it. And also, we have only 1 person doing it. So there is no different criteria on, oh, I don't know what he was thinking last week. So I think this different. So if you have 1 red, you're in red. If you have 2 yellows and 1 green, you're in yellow. You need to have the 3 in green to be in green.
Thank you for explaining that.
Wait, Tasha was.
No, that's.
Oh, okay. So yeah, from the beginning, we're giving the same information with the same measurements and the same person evaluating everything and taking away the correctional cases from the community when it's necessary. in those 2 zip codes that are really affected.
And really, ADHS is now following the colors that we were always using.
Yeah.
With the range that we were always using.
And that was because the counties complained that they gave one measure for us to follow and they were doing another one. But you know that sometimes happened with the Department of Education too. So it's like they tell us to do one thing and they're doing another one.
Well, thank you so much. Corey, did you want to talk about the Binax?
Sure. So as it was reported with the State Health Department and with Governor Ducey, there's been a deployment of Abbott, Binax Now, rapid antigen test cards. You do not need a machine to run this type of test. It's done through droplet of reagents that are in a box already. The initial thought was to have these deployed to schools statewide, but the issue is it requires a clinical lab certificate or a clinical lab waiver. And that costs money, and that takes a lot of training, and you have to have trained people to conduct this test. So we went ahead and contacted our healthcare communities and our pediatricians in our communities to see if they would take these tests and be a part of this program. So this is a work in progress, and not every doctor's office has this clinical lab certificate or waiver as well. So it takes a little bit of effort on our part to research that and to reach out to our partners. So we do have one that we have a deployment of test kits with, and that is Starlight Pediatrics in Casa Grande. And I believe that Jan shined that out to you guys. And they operate an urgent care with several pediatricians on staff from 5 p.m., that's 1700 for you previous military people, and to 0100 1 a.m., which is great because after hours is always an issue on receiving testing abilities. So Starlight is a great partner, and they are on board with this program. The other caveat is that they also need to test for flu, because you can, as Mariana, Dr. Casal has said, you can have flu, strep, RSV, COVID, all in one big issue.
Lucky person.
One big lucky person. So with that, we want to make sure, especially entering flu season, that we are confirming if it's flu and COVID or one or the other. So they're running that assessment. We also think too, pediatric population, the K through 12 school age children, if they are symptomatic, we want to make sure that they're getting the medical care possible that they should be, because it could be other things as well. And actually having more than one infection at a time is not good for anybody, including our K through 12 school age children. They do have to be symptomatic. So so there's still the other testing capabilities with Paradigm, with Embry Women's Health at Post and Butte, and other pediatricians' offices or healthcare providers or urgent cares or hospitals. So, but this is just a separate deployment of test kits. So we're also looking at a pediatrician's office in Santan Valley, and our Sun Life family health centers are also starting to onboard. They're not ready yet, so don't pound on the door with them yet. But as we get our partners, our healthcare partners on board, Jan will message that out to you guys, and you can give your parents that information if they do have a symptomatic child. We also don't want children coming to school sick, symptomatic. So we definitely want them going to a healthcare provider versus the schools getting into the testing business. That's not a good thing for us, we feel. So that's the status of the Vinax Now test kits. And Jan, did you have anything else, or is there any questions?
Yeah, there's a couple questions, and I do want to thank you for setting this up because I know it took a lot of work to start getting providers on, and I know you're continuing to do that so we can kind of get cross-county coverage, so I appreciate that.
We're working on it.
Christine asks, isn't the PCR test more accurate than the antigen or the rapid test?
PCR against, okay, so there are two things measured when you have a test. One is the sensitivity and the other one is the specificity. The sensitivity is that the test will be able to actually detect the disease, detect that the person is sick or not. The specificity is that the test will detect the disease that you want to detect. And this, for example, the antibodies are not really specific because they have cross reactions with any other coronavirus, and the common flu is a coronavirus. So that's why it has been discarded absolutely. They are not even now probable. They are only suspected cases, maybe someday, because the specificity is not good, and not even the sensibility, because it's going to be for any coronavirus. Then the antigen, the sensibility to detect that somebody is actually sick is between 80 and 88%. And it's because it's very specific. It's 100% specific because you're detecting a piece of the virus. But it's not really good, especially in a rapid test, to be detecting everybody that is sick and exposing people as actually a positive case. And that's why they're reported as presumptive, and they need a PCR nasopharyngeal to confirm that they're negative or not. Then in the PCR, it is super specific. It's super sensitive. It's between 95 and 97% only when the sample is taken nasopharyngeal. And the PCR, and it's 100% specific. It will detect this virus and not other virus. It's not that it's going to say, oh, this other virus looks like. It's super specific because it's detecting the genomic of the virus. But the sensitivity in the PCR will depend on the sample. So the 95 to 97% is with the NP swab, the one that goes up to the nose, scratching your brain.
And sometimes people get confused. That is different than just a nasal swab.
Yeah, so then there is a nasal swab.
Right. That's
The
different.
nasal swab, if you see a kid picking the nose, that's a nasal swab, only goes there. And that will reduce the sensibility of the test because the virus, to be able to expand or spread, needs to get to the tip of the nose, so you can you sneeze or you touch it and then leave it someplace. So there is time that it's going to take. We have people that has nasal swab negative in PCR and nasopharyngeal swab positive, especially people that don't have too many symptoms. So, but they are sharing anyways. But the rapid has another problem. It depends, as the sample depends on the viral load. If you take the sample too early with a rapid, maybe the amplification for the RNA is not big enough to detect the sample. And sometimes it can tell you that it's inconclusive, and we need to repeat the sample and repeat the test. That's why with PCR and antigen, if they are positive, super. But if they are negative, we cannot trust them 100%. I hope that was kind of clear. For the science teacher, was clear.
So that's the great thing about this Starlight, though, because if you go in and you do a rapid test, and you can do the confirmatory test on site because they are a medical facility, whereas if we had done it in the school nurse's office, they wouldn't have that capability. Right. And also, thanks for asking, Lori, the Starlight testing is free of charge, so that's good. I have a couple more questions in the chat box, and I know we're getting a little bit over on time. I'm wondering if the folks that are interested in sticking around would just like to hang out just and catch these quick last questions. And then I think you had one that was emailed to you.
Yes.
Okay.
So I have a very good question in my email. Too many people are asking why they should report to us, why the schools are reporting to us, and they have parents that are coming saying that the school is violating the HIPAA law on reporting to the state public health. And the truth is that the HIPAA law is true that you should not know what is happening, but we have an executive order now because this is a pandemic. It's not regular time. Everything is made specifically for us to try to catch the cases and try to control it. So you need, the school always have mandatory report of diseases. And you have certain time to tell us. There is a list in ADHS, and I can share that. I know that the nurses have them. And actually the schools, because they are congregated settings, need to report some mandatory diseases that the rest of the people don't need to. But COVID was added into the mandatory report by the executive order from the federal level, and in Arizona from the from Governor Ducey. So
The executive order is 2020-03.
2020-03.
That's 03.
Yeah, and it's on our website under executive orders.
and it's there too. Yeah.
And I'd be happy to include the link to the reporting list.
Dash
That's
03.
03.
Yeah.
So that's why the school are mandated to report. So nobody can tell you not that you should not do it, that is HIPAA. And we have that problem all the time because HIPAA is not well understood. But yeah, if you don't report, you're not following the executive orders.
Okay, Julie is asking about like the definition of what hybrid learning looks like, and we are using the Department of Ed's definition of hybrid education. So I would just defer back to the Department of Education about how many students are on campus at any given time and all of those types of things. And then the last question I have is, so if a school hasn't opened yet and the benchmark is open is 7%, do you recommend that we open? Since several communities could be over the 7% or the yellow category, which was on all the documents that we've sent thus far.
Please forget the 7%. That's the first thing that you need to know. The 7% is the middle between the 5 and the 10. And if you are in that 7%, then you are hybrid. So you need to be looking at that. Under 5%, because the 7% is only one thing, and you're looking at the number of cases and the number of positives. So that's why we look at three things and we give you one color with the combination of them. So if you're under 5% in positivity rate and under 10 per 100,000 cases, then you can open in the normal, kind of the normal way. If you are in yellow for those two things, the one that says percentage of case, that will be between 5 and 10%, and the number of cases that will be between 10 and 100, then you are in yellow, and that means hybrid. And that's the only thing that we say. As Jan already said, she knows much better than us, or at least me, on what the Department of Education says about the hybrid. But that's why you have the code hybrid up there. So don't get into the 7%, please. I'm sorry that this happened, but we never use it.
Well, that's all the questions that I have in the chat box. And I do want to thank everybody for sticking around a little while so that we can clean up those last few. I will send out the video for this and any relevant links that we've discussed today. And of course, you know what to do if you have questions. Keep them coming. These have been great. And we're so grateful that everybody's asking the questions now before before we're starting to plan things and get going. I appreciate too that many of you had to cancel your October, your Halloween events or modify them significantly. So happy Halloween, despite the fact that it may look very different this year. Thank you.
Bye.
Bye.